Familiar habits meant to protect the brain can silently lead to a stroke while you sleep. Have you ever thought that small habits, which seem healthy, could pose a major threat to the health of your brain? Imagine a normal morning. You're sitting and reading a book to your grandchild, watching the warm sunlight streaming through the window. But suddenly, a strange sensation appears. You can't speak, your right arm becomes heavy, and you can't lift it. Your mind goes fuzzy, and everything starts to blur. This is a real scenario that could happen to anyone, especially older adults who we often think are healthy and live a good lifestyle. I am a brain specialist, and for over 3 decades, I have witnessed many cases like this. Older adults who are careful and live healthily suddenly experience a stroke due to habits that seem harmless or even protective of health. This is not a coincidence, but a serious issue that can happen at any time. Why can these habits lead to a stroke? It's due to a series of subtle factors happening in our bodies, especially while we are sleeping, a time when the body cannot protect itself. Healthy foods, the greens and nutritious foods that are good for our health, can sometimes carry hidden risks if not used properly. Aging. As the body ages, things no longer work the way they used to. The circulatory system, nervous system, and other organs no longer function as efficiently as they did in youth, leaving you more susceptible to external factors. Improper use of medications, forgetting to take medication, taking it at the wrong time, or even taking the wrong dosage can cause disruptions in blood pressure, heart function, and increase the risk of stroke. Eating too healthily. A healthy diet can become dangerous if you make sudden drastic changes. The body may not be able to adapt to these changes, reacting unexpectedly. Nighttime effects. During sleep, blood pressure can drop, hormones fluctuate, and blood starts to clot without you realizing it. These changes make the body weak and vulnerable. So which habits or foods are actually endangering you each morning when you wake up? Are the things you do every day protecting or harming your health? Let's dive deeper and find out. Silent stroke risk. Symptoms like dizziness, weakness, or fatigue in the morning are often overlooked by many as just part of the aging process. You wake up feeling a bit lightheaded, your limbs feel heavy, or sometimes your speech may be unclear. You tell yourself, "I must not have slept well," or "It's just old age, who doesn't feel a little weak?" However, these signs could be early warnings from your body, and they're not trivial. Feeling dizzy and weak every morning could be symptoms of a TIA, transient ischemic attack, or a mini-stroke, which is a small stroke that can happen in just a few minutes and then disappear. However, don't let its disappearance deceive you. A TIA is not harmless. It's a sign of potential damage in the brain, which could lead to a larger stroke if not properly addressed and treated in time. These symptoms mainly occur in the morning, when blood pressure can suddenly fluctuate, and blood flow isn't as good as when you're awake and moving. Furthermore, your body isn't fully alert yet, which makes it easier to miss these subtle signs. If you feel dizzy, weak, or have issues with speech, such as slurred words or numbness in your mouth, this is the time not to ignore them. Take note of these symptoms and seek help immediately. Recognizing and responding promptly could help you avoid the risk of a major stroke later on. Mild symptoms like dizziness, weakness in the limbs, or unusual sensations in the face could be signs of a serious issue developing in the body. Ignoring these signs could cause you to miss an opportunity to save your own life in the future. Regardless of your age or health condition, it's crucial to listen to your body and not ignore even the smallest symptoms. Doctors always advise that if you feel unwell, whether in the morning or at any time during the day, write down the symptoms and share them with your doctor. Never self-diagnose or think, "It's probably nothing," because sometimes a moment of neglect could be the defining moment for your health. So, if you feel dizzy or weak in the early morning, don't hesitate. Record the symptoms, share them with your doctor, and don't let them become a major regret in the future. Your body is warning you about what's to come, and listening to it will help protect your brain and keep you living a healthy and independent life. A hidden stroke risk. When morning comes, you open your eyes and feel like a new day is beginning. But small habits like taking your medication on time can easily be overlooked. You may forget to take a dose at night, or you might think that taking 2 pills the next morning to make up for it is okay. But did you know that this habit can cause serious harm to your body, especially for older adults with heart conditions, high blood pressure, or high cholesterol? Mrs. Evelyn, a 76-year-old patient I treated, is a perfect example. She was an independent, cautious woman who managed her health carefully, particularly her blood pressure. However, occasionally she would forget to take her medication at night, and, to make up for it, she would take double the dose the next morning. One day, after missing her medication for 2 days, she woke up with a severe headache and difficulty speaking. By the time the emergency team arrived, she was suffering from a stroke caused by brain hemorrhage, the result of incorrect medication use and a sudden change in blood pressure. What's concerning is that misusing medication every morning is not a rare mistake. Most blood pressure medications, blood thinners, or heart medications need to be taken at the correct time, in the correct dosage, and as directed by your doctor. In the morning, your blood pressure and heart rate tend to fluctuate, making your body more susceptible and increasing the risk of severe complications if not managed properly. Moreover, some people have the habit of taking their medication with coffee or without enough water, which can reduce the effectiveness of the medication and even cause adverse effects. The consequences of not taking medications correctly are not just short-term changes in health. When medications aren't taken on time or in the correct dose, it can cause your blood pressure or heart rate to become unstable, increasing the risk of stroke. Furthermore, skipping medications reduces the protective effect on your brain and circulatory system, making your body more vulnerable to serious risks, especially for those with a history of heart disease or diabetes. The most important advice for you is to establish a consistent medication routine every morning. Use a pill organizer with compartments for each day, or set an alarm to remind you to take your medication on time. Never skip consulting your doctor if you feel your medication dosage needs adjustment, especially if you have a history of irregular medication use. Maintaining stability in your medication routine can be the first step in protecting you from the risk of future strokes. Just changing a small habit like taking your medication on time can make a big difference in protecting your health. Don't let a small mistake turn into a serious problem in the future. Start today and give the proper attention to taking care of your health. In the early mornings, many older adults have the habit of drinking a cup of coffee right after waking up, often on an empty stomach. Coffee is a familiar beverage that helps people feel awake and refreshed, but few are aware that drinking coffee in the morning, especially without eating anything, can have serious health consequences, particularly for older adults. Let's imagine Mr. Charles, a 77-year-old veteran, who always maintained the habit of drinking 2 cups of coffee every morning. He believed that coffee helped keep him alert and sharp. One morning, he drank his coffee as usual before having breakfast. Just a few minutes later, he started feeling his heart rate increase, then suddenly felt heavy and short of breath. He collapsed and was rushed to the hospital. He was diagnosed with a stroke caused by a sudden blood pressure shock, which occurred due to drinking coffee on an empty stomach. So, what exactly happens when you drink coffee early in the morning on an empty stomach? Coffee is a powerful stimulant that increases the body's adrenaline levels, causing blood vessels to constrict, raising blood pressure, and making the heart beat faster. When consumed on an empty stomach, caffeine is quickly absorbed by the body, making its effects more intense and sudden. For older adults, especially those with weak circulatory systems and less elastic blood vessels, this sudden change can cause serious issues like stroke, arrhythmias, or even heart attack. Furthermore, coffee can cause dehydration, which thickens the blood and increases the risk of blood clots. When the body becomes dehydrated and blood pressure changes suddenly, blood circulation in the brain is severely affected, particularly for older adults with underlying conditions like high blood pressure, diabetes, or heart disease. To reduce this risk, the advice is to change your coffee drinking habit. Start your day with a glass of water to replenish the fluids lost overnight and properly hydrate your brain. Then, have a light breakfast, perhaps a slice of bread, a banana, or some cereal. After eating, your body will be more stable, and coffee won't put sudden pressure on your circulatory system. At that point, you can safely enjoy your coffee without harming your body. Drinking coffee on an empty stomach not only raises blood pressure, but also increases the risk of stroke, especially for older adults. Change this habit today. Start your day with water and have breakfast before drinking coffee to protect your brain and circulatory system. Coffee can be a great companion in the morning, but when used correctly, it won't become a hidden threat to your health. A habit that seems harmless and perfectly normal every morning, holding urine for too long. Perhaps you found yourself in a situation where you're in a rush in the morning, too busy with the day's tasks to stop and use the bathroom, or you simply want to finish what you're doing before going. However, this habit can be one of the hidden factors that increase the risk of stroke, a risk few people consider. Mrs. Darlene, a 79-year-old patient from Indiana, is a perfect example. Every morning she would check her emails and read the news on her iPad before going to the bathroom. She didn't want to feel rushed, so she delayed going to the toilet until she truly couldn't hold it anymore. One morning, after a restless night and a cup of coffee, she got up and suddenly collapsed to the floor, unable to stand. She had a sudden spike in blood pressure, which led to a mild stroke. Although she survived, her balance was never the same again. So, Why is holding urine so dangerous? When you hold your urine, your body begins to react as if it's under stress. A full bladder creates a type of stress in the body, increasing cortisol levels, the stress hormone. These hormones activate body responses, including blood vessel constriction and increased blood pressure. Especially for older adults whose blood pressure may already fluctuate abnormally, a sudden increase in blood pressure can be extremely dangerous, as the blood vessels in the brain are already fragile and vulnerable. Additionally, holding urine for too long can lead to heart arrhythmias and increase the risk of blood clots, both of which are stroke risk factors. In addition to raising blood pressure, holding urine for too long increases the risk of urinary tract infections, particularly in older adults when the immune system is not as strong as it used to be. This can lead to not only discomfort, but also an increased risk of cardiovascular and urinary issues, potentially leading to more serious conditions. My advice to you is to never delay using the bathroom, especially in the morning when your body has just woken up. When you feel the urge to go immediately to avoid causing stress to your body. Don't let work or your daily routine make you forget self-care, as this simple action is incredibly important for long-term health. Don't let the habit of holding urine become a potential health risk. It's a small action that can help reduce your risk of stroke and other serious health problems. Take care of your body from the smallest habits, because it's these everyday routines that shape your health in the future. One habit that nearly everyone has every morning: waking up and quickly standing up to start the new day. However, few realize that this seemingly harmless action can lead to one of the most serious hidden risks for health, especially for older adults. This is the habit of getting up too quickly after sleeping, which can reduce the blood supply to the brain and lead to a stroke. Mr. Ray, 74 years old, is a perfect example. As a farmer who had spent many years getting up early to work, he always rushed to get up every morning, without paying attention to the fact that his body hadn't had time to adjust to a standing position after a long night's sleep. One morning, he quickly stood up and started walking to the kitchen, when suddenly he felt dizzy, lost his balance, and collapsed on the spot. When his wife found him, he could not speak and was paralyzed on one side of his body. An MRI revealed that he had suffered a stroke due to an abrupt drop in blood flow, when his body hadn't yet adjusted from a lying position to a standing one. So why is getting up too quickly so dangerous? When you wake up after a long sleep, your body is still in a relaxed state. Blood circulation is slower, blood pressure drops, and the body hasn't adjusted to the standing position. When you get up too quickly, gravity pulls blood away from the brain toward the lower body, reducing the blood flow to the brain, leading to a condition called orthostatic hypotension, low blood pressure upon standing. For older adults, especially those with low blood pressure, heart disease, or arterial problems, this sudden change can prevent the brain from receiving enough oxygen, causing symptoms like dizziness, fainting, or even a stroke. The consequences of not being careful when standing up can be much more serious. When you fall, you not only risk injury, but also face other complications like broken bones, especially in older adults with low bone density. A fall can not only make you lose your balance, but also affect your mobility, and ultimately reduce your quality of life in the long run. The advice for you is, when waking up in the morning, Don't rush to stand up immediately. Take a few seconds to sit on the bed, breathe deeply, and let your body gradually adjust to the standing position. You can gently move your fingers and toes and stretch before standing up. When you do stand, do so slowly, giving your blood time to circulate evenly throughout your body. This will minimize the risk of dizziness, fainting, and protect your brain from unwanted shocks. Such a small action every morning can make a big difference in protecting your health. Don't let the morning rush become a hidden factor, leading to dangerous complications. Instead, take a moment for your body so you can start the day with health and alertness while protecting your long-term well-being. A lesson in mindfulness. While we often focus on major factors like diet and medication to protect our health, sometimes small, seemingly harmless habits can silently harm the brain and increase the risk of stroke. One such habit that is often overlooked is inadequate or poor quality sleep. Although it may seem simple, sleep deprivation can profoundly affect your health, especially for older adults. When you don't get enough sleep, or your sleep isn't deep enough, the body can't fully recover. Specifically, during sleep, the cardiovascular and circulatory systems undergo adjustments to prepare for the new day. Sleep deprivation disrupts this process, leading to elevated blood pressure and preventing the body from recovering optimally. As a result, the body becomes more vulnerable when it faces changes in blood pressure or blood circulation in the morning, especially during the moments right after waking up. A typical case is that of Mrs. Mary, 78 years old, who experienced a mild stroke after several consecutive nights of poor sleep. She often stayed up late due to family issues, which disrupted her sleep pattern. One morning, she woke up feeling dizzy and unbalanced. After being diagnosed, the doctor confirmed that her chronic sleep deprivation had negatively affected her circulatory system, making her more susceptible to a stroke. When the body doesn't get enough rest and recovery time, the nervous and cardiovascular systems cannot function optimally. Blood pressure may rise suddenly, and blood vessels lose their elasticity, making them prone to stroke risk, especially when combined with other factors like stress, improper medication use, or sudden changes in habits. The simple advice is to ensure a sufficient and restful sleep each night, especially for older adults. The body needs at least 7 to 8 hours of sleep per night to regenerate energy, repair cells, and restore balance to bodily functions. If you regularly stay up late, consider establishing a consistent sleep routine and creating a quiet, comfortable space for sleep. This will give your body enough time to recover, reduce stress, and protect your brain from risks. Sleep deprivation is one of the dangerous habits we often overlook. Don't let lack of sleep become the cause of stroke or other serious health issues. Develop a healthy sleep routine, as sleep not only helps restore the body, but also protects your long-term health. After exploring the habits that often go unnoticed and can lead to a stroke in older adults, you may realize that some small actions every morning could actually be serious warning signs. Stroke doesn't always occur suddenly and obviously. Sometimes it's just a series of seemingly harmless habits that we don't notice. These seemingly normal habits every morning can be silent risk factors, increasing the likelihood of a stroke occurring. We have analyzed dangerous habits, from ignoring symptoms like dizziness and weakness in the morning, to misusing medication, drinking coffee on an empty stomach, and holding urine for too long. Each of these habits, no matter how small, can have long-term negative effects on health if not corrected immediately. These seemingly harmless habits not only affect blood pressure and heart health, but also increase the risk of stroke, especially for older adults when the body no longer has the strength to cope with sudden changes. However, the good news is that everything can be changed. Being aware of and adjusting these small habits can help you prevent stroke and other serious health issues. Remember, starting your day with a good habit, like drinking water immediately upon waking, having a proper breakfast before coffee, and not delaying bathroom visits, will help protect your health, especially your brain and circulatory system. Final advice: don't let small daily habits affect your health. Change them today to protect your well-being and enjoy a healthier life. Start with small changes, like getting up slowly, taking your medication on time, and not rushing with coffee or holding your urine. These small changes can significantly reduce your risk of stroke and help maintain long-term health. Remember, health is your most valuable asset. Don't let bad habits destroy it. Make changes today. Protect your brain and cardiovascular system, and enjoy the beautiful years ahead with a healthy body and a sharp mind. We have just explored habits that seem harmless, but silently harm the health of older adults, especially increasing the risk of stroke. Habits like ignoring dizziness and weakness in the morning, misusing medications, drinking coffee on an empty stomach, holding urine for too long, and getting up too quickly after sleeping can all lead to serious consequences, if not recognized and changed in time. Stroke isn't an abrupt issue. It's the result of small mistakes accumulating over time. Forgetting to take medication once, holding your urine too long, or standing up too quickly can all be warning signs that we don't notice. If these habits aren't changed, they will put pressure on the body and increase the risk of emergencies like strokes or heart problems. However, the important thing is what you can do to protect yourself right now. You can change these habits, and by doing so, you'll reduce risks and maintain a healthy, sharp body throughout your life. Final advice: don't let seemingly harmless habits become a major risk to your health. Simple changes every day can help protect your brain and circulatory system from negative effects. Start by changing small actions you can implement today. Get up slowly. When waking up each morning, take a few seconds to sit up and take deep breaths before standing. This helps your body adjust and reduces the risk of dizziness or fainting. Eat breakfast before drinking coffee. Start your day with a light breakfast and a glass of water, then have your coffee. This helps prevent shock to the body and reduces the risk of a sudden blood pressure spike. Take medications on time. Establish a routine for taking your medications on time, without forgetting or taking them incorrectly. Use a pill organizer or set alarms to ensure consistent and accurate medication use. Don't delay bathroom visits. When you feel the urge to use the bathroom, go immediately. Don't hold it in. This helps reduce pressure on the body and the circulatory system. With every small change, you're helping protect your health, keeping your brain strong, and minimizing the risk of stroke. Your health is your most valuable asset, and protecting it starts with small daily actions. Act today to protect yourself and your loved ones. After discussing the hidden dangerous habits and how they can lead to strokes, it's time to talk about specific actions you can take to protect your health starting right now. Changing habits is not difficult, but it requires persistence and awareness of their long-term impacts. Small changes in your daily life can bring huge benefits to your health, helping protect your brain, cardiovascular system, and other vital organs. Start your day the right way. First, make sure you start each day calmly and focus on your health. A healthy morning routine not only keeps your body healthy, but is also the first step to protecting your brain from negative impacts. Don't rush to stand up immediately after waking up. Take a few seconds to sit up slowly, breathe deeply, and help your body adjust to standing. This simple habit is extremely important, as it helps reduce the risk of dizziness, fainting, and more serious consequences. Ensure a healthy diet. Eating properly is a key factor in protecting your cardiovascular health and brain. Breakfast is the most important meal of the day, so start your day with a nutritious meal. Eat breakfast before drinking coffee to prevent a sudden spike in blood pressure, and ensure your body has enough energy for the day. Foods rich in fiber, vitamins, and minerals, such as fruits, whole grains, and low-fat foods, will help keep your body healthy and support your circulatory and brain systems. Use medication properly. One of the important things we need to focus on is using medications correctly. Especially for older adults, forgetting to take medication or taking it incorrectly can lead to serious consequences. Establish a routine to take your medication at the same time every day, and always follow your doctor's instructions. Using a pill organizer or setting alarms is an easy way to remember to take your medication on time. This will help stabilize your blood pressure and maintain cardiovascular health, thereby reducing the risk of stroke. Take care of your mental and physical health. It's not just about taking care of your body. Maintaining mental health is equally important in protecting your brain. Find ways to reduce stress every day, such as engaging in light physical activities, practicing meditation, or simply spending time relaxing and socializing with friends and family. A relaxed mood and positive mindset will help your body recover quickly and stay healthier. Final advice. All of these tips are only valuable if you act on them today. Don't wait until you notice symptoms before making a change. Small habits may not cause harm immediately, but when they accumulate over time, they can become major health risks. Pay attention to your daily actions and make healthy changes to protect your brain and overall health. You're never too old to start taking care of your health, and these small changes today will help you live healthily, independently, and full of energy in the future. Don't hesitate. Start today.